It's now time.
Bell time.
Okay.
Yeah.
See you later. Bye.
Anna. So, hi, another warm welcome from Midland Golden Retriever Club. We're really excited to have Dr. Laura Owen with us this afternoon, who is going to talk to you about ectopic ureter, which has been a problem in the breed ever since I've been involved. And I know that Margaret Woods, the health rep for the Breed Council, has done an awful lot of work to try and develop an awareness of the problem and look at different ways of treating. And we're very, very privileged that Laura has been doing a lot of very interesting background work. And I'll pass you over to Laura.
Thank you very much, Penny. I'm delighted to be here this afternoon. And I hope that by the end, I will have managed to explain to you exactly what we're dealing with. And we'll probably have still more questions than answers. But when we know what the questions are, we can start hopefully working together to find the solutions.
That's great. We'll open up the chat at the end of your talk so that people will be able to type in and ask questions. So during the actual talk, or everybody will be on silent, but we'll open the chat at the end. So that would be great. Yeah, super.
Okay, so I'll just share my screen, I hope. Okay, can you see that okay?
Yeah, that's great.
Lovely. Let me just minimize everybody else. That's it, so I can see. Lovely. So Penny's invited me this afternoon very kindly to discuss with you a little bit more about what you would term wet puppies, or otherwise we would term ectopic ureters as the medical sort of synonym. So the title of my talk is Fixing the Leaky Tap, Ectopic Ureters Explained, and hopefully you'll feel that you know a lot more about them when we get to the end. Oh, just forward. So the plan of the talk is we're going to look at what are ectopic ureters, because many of you may not be familiar with this condition. We're going to look at how we might recognize or diagnose the condition, what the treatment options are, and then importantly at the end we'll talk about the research that I've been doing and what we might be able to do either now or in the future to see if we can reduce the incidence or prevent this condition. So to begin, what are ectopic ureters? Why are these puppies wet? So here is a picture. It is drawn by my own hand and I'm no artist, so it's not going to be perfect, but hopefully we can look at this together. So this comprises the urinary tract in a dog. So what we would have is two kidneys. So this is one here sitting just under the rib cage and one the other side. And then the ureter is in green, this tube that connects the kidney to the bladder. So the kidneys will filter any of the unwanted substances from the blood and any water that we don't need. That will make urine, and then the urine will travel down the ureter into the bladder where it will initially be stored. And then when the bladder becomes full, it will cause the muscle of the bladder wall to stretch. That will trigger some receptors to say we need to pee here, and then this bladder muscle will contract, and this tube, the urethra, will relax, and that will allow the urine to exit the vulva. So it's unfortunate these two have very similar names, but the ureters are what we're going to be predominantly talking about today. And then we have the urethra, which is the tube from the bladder to the outside. So if you can just remember those two things, that will help you to understand what's going on. And this system is very complex. It's probably one of the most complex body systems. We have the anatomy, which needs to be right in order for this to work. We also need to have a fully functioning nervous system. And that involves both the involuntary nervous system, because most of this goes on, sorry, without us knowing about it. We're not choosing to contract our bladder and urinate most of the time. That just happens. And then we do also have some voluntary control. So if we're not in a place or the dog isn't where they can urinate, they will be able to hold that urethra nice and tight and wait until a more suitable moment. There's also hormones that influence this system, such as estrogen. And then there are other substances and receptors that all come into play as well. So it really is a very complicated system, and that in part will explain why the outcomes are not as simple as we might expect when we get further along. So what is an ectopic ureter? Well, if we look at this normal ureter on this side, it's coming down and it should enter roughly this triangular area of the neck of the bladder. So here is our normal opening. When we have an ectopic ureter, it means that the opening is instead further down in the urethra instead. There's two types. The most common, which is in about 95% of dogs, is the intramural type. So, sorry, I keep losing my cursor, here circled in red. And with the intramural type, the ureter enters the bladder wall at roughly the same location as the normal side, but instead of having an opening that the urine can get out of into the bladder, this ureter instead travels through the wall and then it opens at any point along this urethra. The second type that we can have is an extramural ectopic ureter. And in this case, here's our extramural ectopic ureter. It's completely bypassing the bladder and it's just entering the side of the urethra. And this is quite rare in dogs. It's much more common in cats. So in dogs, it makes up less than 5% of any cases that we see. And so what we will normally see from this condition is urinary incontinence, because the urine is not being stored properly in the bladder and it is instead leaking out through the vulva or the prepuce. We know that this is an inherited disease because it only affects some breeds. So we know that it affects the golden retrievers, and that's why we're all here today. Also affects the Labrador retriever, generally in smaller numbers. The poodle, usually the toy and the miniature, are affected. Newfoundlands, and then we have Siberian Huskies, French Bulldogs, just to add to their list of problems, and several more. And then we have other breeds, for example, Greyhounds, Hungarian Vizslas, Dobermans, Rottweilers are breeds that this condition has never been reported in. So it is breed specific and therefore a heritable disease. As we'll see later, unfortunately, the heritability is not simple. How do they present clinically? Well, classically, hence the term wet puppies, we would see this condition in young puppies, certainly less than 6 months of age, and very commonly at weeks of age. So an absolutely classical presentation would be a breeder who would notice that the puppy was wet, anything from a few days after birth to a few weeks, and then would present that puppy usually to the local vet. They would often give a course of antibiotics to check that it's not just a urinary tract infection, and the incontinence would unfortunately persist, and then we would have a very strong suspicion in an affected breed that ectopic ureter was the problem. It's not always noticed that young. Sometimes if the puppies are with mum and she's very good at cleaning them, sometimes, or they've got just very mild incontinence, then it might not be noticed until that puppy goes on to a new home. And then the new owners might notice some little wet spots on the floor, or that the puppy is generally sort of damp around the perineal area. As well as the mum not being present to clean the puppies, the other thing that changes as they get older is they produce more urine because they're bigger dogs. And that might also be a reason why you might notice. and the urine becomes more concentrated as the puppy grows. So the smell of urine might become more apparent as the puppy is a little bit bigger. So might see wet perineal area, we might see spots of urine on the floor, we might see actually urine just dripping from the vulva or prepuce, or we might see that either the puppy or the mum is excessively licking that area. And we may find just a urine smell, we may have a more nasty smell based on a subsequent infection of that urine. So that would be absolutely classically what we would see. But we do see this condition in older dogs as well, and that's any age. It's been reported to be diagnosed in dogs up to the age of 10 years old, and I suspect there are dogs that are even older that just haven't been diagnosed. Can be males and females. It's more likely in an older dog that it would be a male that we would have missed when it was a puppy. And the reason, I hope, is explained in this diagram here. So in the bitch, we have the bladder and then a relatively short urethra. It has some smooth muscle all the way along, which is under involuntary control. And then just at the end here, it has what we call striated muscle, which is under voluntary control. So this is the bit that the dog can squeeze itself. In the male, we've obviously got this much, much longer urethra. And again, all of that is lined with muscle, with the smooth muscle. And then 2/3 of it is also lined with this muscle that's under voluntary control. So in a male dog, this urethra has much, much greater muscle tone than in the female. And that means that the males may not necessarily be incontinent until maybe they get much older, and then unfortunately, as with most things with age, they get weaker with time. And so when these dogs are older, this muscle potentially weakens, and then the dog may become incontinent at 5, 6, 7, 10 years of age. Often the older dogs are not investigated in the same way as the young dogs, because it's assumed that maybe it's due to old age, and that's why the dog has become incontinent. But in breeds that are affected by ectopic ureter, it may well just be that this condition has been kind of lying dormant all this time, and then has only become apparent when the muscle is weakened. So here's just the urine that might come out of an ectopic ureter. And what we'll find, if I can just draw, quite often ask people, well, if there's ectopic ureter, how come my dog can also urinate normally? So the answer is that if the urine comes out here into the urethra, it could go one of both ways. If this is nice and tight, this muscle, then the urine could still flow backwards into the bladder. And maybe when the dog is lying down asleep or resting and this muscle is weaker, we might find that some of the urine drips out this way. And in the male, even more so, the urine is mainly going to travel backwards into the bladder, even though it's coming out in the wrong spot. So these dogs will still urinate completely normally outside often, as well as having their urinary incontinence. We also find that not all ectopic ureter dogs are incontinent. So again, if that muscle is really nice and tight, then these dogs might be able to control their urination their whole life. We might not see anything at all, or they might present for other reasons, something like urinary tract infections that they are prone to, and that might indicate that there's something underlying. So if we're suspicious of this condition, we have a dog of a breed that we know is affected by it, so in this case the golden retriever, and we see either urinary incontinence at any age, or we have some other urinary tract issues such as infections, or something else that isn't right, like a very enlarged kidney that's found, then we would be suspicious of this disease. In order to diagnose it, we would initially recommend that each dog has a blood sample just to check that kidney values are okay. And they are normally normal, if that makes sense. We don't usually see any abnormalities, but it is worth checking just in case there is some significant kidney injury. And then we would always want to have a urine sample, which is looked at with a dipstick and maybe under the microscope, and then is also sent away so it can be cultured for any bacteria that are in it, so that we know before we start to do any other tests or treatment whether we're also dealing with infection. Infection is very common. If you have urine that's able to leak out, then that means that the bacteria are also able to go in. Now, how we get this urine sample varies a little bit. Our ideal sample is taken with a needle directly into the bladder, often with ultrasound guidance. And if we get our urine sample that way, then we know absolutely for certain that if we grow bacteria, they must have come from the bladder. If we catch a urine sample after it's been voided, so we just follow the dog around with a tray or some other bowl in order to catch the urine, then it will have touched the dog's hair and the bowl and other things on the way. And we won't necessarily know whether the bacteria are just contamination or whether they represent infection. If you have a puppy that's very incontinent, however, it may be that the bladder is never full enough to get the absolutely ideal test, and we need to get whatever urine sample we can manage. Once we've done those initial tests, and if we've found an infection, we would treat it. Then we would look to ultrasound as a first test to see what's going on. So in the picture, we've got Professor Mike Heritage, who's a sort of legend of the University of Cambridge, who's ultrasounding one of the golden retrievers for me. So he will be looking at the kidney size and their structure to check if that's normal. And then he is able to follow the ureters as they come down from the kidneys towards the bladder. And he'll be able to look at what size they are and where exactly they're going. He'll also be able to look at bladder size and shape, make sure that that looks normal. And then we'll be looking for the entry points of the ureter into the bladder or urethra. And to help us do that, we quite often give a diuretic injection. And what that does is it just makes more jets of urine, so we've got a better chance to see them. It is very difficult, this ultrasound. It's easy to look at kidneys and it's easy to look at the bladder, but it's very challenging to look at ureters. So ultrasound to look at the ureters themselves is only going to be useful if you've got somebody very experienced doing that ultrasound, and somebody ideally who looks for ectopic ureters many times. The main advantages of ultrasound are that it can be performed conscious. So the golden retrievers are an absolutely delightful breed to work with, and especially the show dogs, they are absolutely happy to be laying down for the ultrasound, and they will usually just go off to sleep or take no notice whatsoever, be nice and still, and we can get some lovely images. If you have some other breeds of dog, then we may need to use sedation. And so this is a non-invasive test, and it gives us quite a lot of information about what's going on. If we're in a situation where there's nobody with the expertise to look at the ureters with ultrasound, then many of you will have come across this kind of a test, I'm sure, which is essentially an X-ray dye study or an X-ray contrast study. And we would call this, the posh name for it is an intravenous urogram, or IVU. So what we can see in this top image, this is just a plain X-ray of the abdomen of a dog. And we can see that there's nothing very distinct here. And certainly the ureters that are only 2 to 3 millimeters in diameter, we have no chance of seeing them on this image. So what we do is we inject a dye that shows up on X-rays into a vein in the dog's leg. And once that dye goes around in the bloodstream, it will be filtered by the kidneys, and then it will travel in the same way that urine will and highlight those structures. So in this bottom image, this dog has been given the dye. We can see then we've got one kidney here, we've got one sitting just behind it, and now we can see these ureters. We've got one main one that we can see here. The other one is hiding a little bit at the back, but this one we can see nicely as it comes down towards the bladder. We've got a little bit of air in our bladder. This is kind of the outline of it here. So this is much more widely available, this test, because you just need an X-ray machine and the dye. But it does normally require a general anaesthetic, and there are very occasional allergic reactions to the contrast. The other thing that's problematic with this dye study is that the dye doesn't move smoothly along these ureters. The muscle is squeezing it along, and it's very difficult sometimes to see exactly where these ureters are going once they get into this bony pelvis area where everything is on top of each other and we can't quite see. So it's simple to do, but not so easy to interpret. We can also put the dye in the other way, so into the penile urethra or in through the vulva. So hopefully this video will play. So the contrast dye is going to be in black on this study. So we can see it's going up the urethra here. And actually it's just ducking into an ectopic ureter, which is coming into the prostate. I'll just see if I can get it off pen a second. Okay, let's play this again. This is the dye coming in, and then it just nips off into this ectopic ureter. Again, this study is widely available. We just need an X-ray machine and some dye, but it requires general anesthesia in females and sedation in males. CT is much more available now, and many local veterinary practices now either have a CT scanner or have access to one. And with CT, what we get is a cross-sectional imaging. So we get slices through the body. And that means that we don't have this situation where lots of structures are on top of one another and we can't see. So this is the same injection dye study as we had on the X-ray in a different patient, and it shows up the kidney really nicely, and we can start to see the ureter, which is nice and white. We can see the other kidney coming in on the other side, and then we'll start to see some dye in this huge ureter here. So CT is a good way if we don't have the expertise again for ultrasound. It gives you a really good idea of what's going on, and it's very clear to interpret, but it is quite expensive. And so in our clinic, it's not something we use routinely. We tend to use it for very unusual cases only. So what I prefer in combination, I guess, with the ultrasound is what we call cystoscopy. And anything that ends in oscopy basically describes the use of a camera which is small, and it can examine internal organs. So in this case, cystoscopy means we're examining the bladder and the urethra, and in a female, we can look at the vagina and the vestibule. So just start this video in a second. We're in the urethra, and this is our neck of our bladder. We're going to be coming into the bladder. So we're coming into the bladder, and this here is one of our, I'll just pause it. This is our right ureter opening. I think we just saw a minute ago some urine coming from that. So this is normal. This is inside the bladder. It's a normal shape and size. Then when we come back out of the bladder, we've got bladder neck. We can just see at the top of the image. And here, this opening is a ureter opening into the urethra. And so this is our ectopic ureter, which will be our left one, because we've seen that the right one is normal. So with cystoscopy, you actually get to see with your own eyes almost exactly where the problem is and what the anatomy is like. So that's my preference, a combination of ultrasound and cystoscopy, and we should know exactly what's going on then with these dogs. The other thing which we will come back to in terms of maybe prevention of this condition is something called a persistent vestibulovaginal remnant, or we can shorten that to something called PVVR. And the reason this might be interesting to those of you involved in stud work is because this is a band of tissue. So it's the arrow here is pointing to it, and another one here, which is dividing the vaginal opening into two. Our urethra, which is where the urine comes out, is up here, marked with the blue spot. And this is the entrance to the vagina in the background here. So this band of tissue, this persistent vestibulovaginal remnant, we see in around 90 to 95% of dogs with ectopic ureters. You can have it in some dogs that don't have that condition, but that's much more unusual. And this one is very, very thin, wouldn't cause any problem, would break easily. This one's a bit thicker. This one here, we can see there's a tiny little opening to the vagina on this side, and then all of this section is abnormal tissue. And in this one, this is a dog with a terrible anatomy. So we've got the urethra where the urine would come out with the blue dot. We've got two ectopic ureters where my cursor is. And then we've got two little openings into the vagina and a big band of tissue in the way. So these two dogs on the bottom, it would be impossible for these dogs to mate and to have any puppies. This one would be able to, and we'll come back to why we shouldn't, but it would be able to. This one, I'm not sure. So this is some part of the anatomy that we might need to bear in mind. This doesn't need treating in itself, but it's just an interesting additional thing that we diagnose. So that's our diagnosis. What about treatment options? Well, the first thing to say is no matter how young we identify these puppies, if we want to treat the ectopic ureters, then we do need to wait until they're at least 12 weeks of age. Before that, their tissues are too prone to swelling and they're too small in order to do the treatment practically. And we need to wait for everything to just mature a little bit. So during this time, we obviously need to monitor their general well-being, these puppies. I have to say that all of the puppies that I've seen with this condition have otherwise been well grown, so they've been the same size as the others. They don't tend to be the runt of the litter. They can definitely be the biggest. So they seem to stay very well, even if they do have some urinary tract infections. But we should make sure they're eating well, they're drinking well. And then we really need to take care of this vulval area, because urine, we know, will scald the skin. And what we don't want is to get some nasty skin infections around those vulval folds. So this means that the puppies need to be washed regularly and then dried nicely. It's easier if we keep them on vet bed bedding as far as possible, because with the vet bed, any urine that is on the bed will get pulled through to the lower layer, and the actual surface of the bed that the dog is lying on will stay dry. We don't want anything that's going to allow the urine to soak in and then for the dog to be lying on it and end up with that urine in contact with the skin. And then the cream or spray that I've had the most success with various breeders looking after these puppies is this spray here, which is called Cavalon spray, which is widely available on the internet and from vets. It's not a prescription product. And this is a barrier spray that will then prevent direct contact of the urine with the skin and prevent any urine scald. Do need to make sure, if we're using a barrier spray, that the skin we're applying that to is really nice and clean and dry. Otherwise, if we have bacteria still on the skin or urine and we spray the barrier over the top, we're going to be trapping that in, and that could make things worse. So the routine would need to be a bath of that area, thorough drying, then application of the spray, and that would need to be done as frequently as needed depending on the level of incontinence. Then when they get to more than 12 weeks of age, then there are a number of treatment options. So for our intramural ectopic ureter, which was our most common condition, then we can do a minimally invasive treatment, which involves the camera and a laser. Sounds very cool, and it is, I think, and certainly very good for the puppies, because as we'll see, the recovery is very quick. Open surgery is what we used to do, and will still be done in lots of places. And we could remove the affected kidney and ureter. That would be another additional option. And we'd certainly do that if the kidney was very abnormal. If we have this rare type, this extramural type, then the only options are open surgery or removing that kidney or ureter. So this camera-guided laser procedure can be done from as young as 12 weeks of age. And the golden retrievers are normally quite a nice size by then, and the tissues are less prone to swelling. Oh, actually, I'll just go back to this. So just to highlight with the pen what we would be doing. I'm actually going to change my color to red. Bear with me. I'm not wanting to change color now. I'll stick with green then. Here we are, red. So our camera is going to come in up the urethra, and then our laser is going to take away this inner wall up here until our opening is now sighted here. So it's now in the bladder. And hopefully this will make sense on the next video. Get rid of my pen. There we are. Okay. So this is going to be the same dog. So this is our normal right ureter that we saw before. We can see into the back of the bladder there. And this is our ectopic ureter opening. So now we're just coming back in. Here's our ectopic ureter opening again. And we're going to put this wire inside. I hope none of this is going to put anybody off their dinner. I haven't included anything that I thought was a gruesome picture, so I hope you're all okay with this. Then we put this orange catheter in. And then using that as a guide, we can then use this laser. And the laser just takes away that inner wall until this opening is moved back inside the bladder. Just move it on a little bit. So here's the laser still doing its work. Until we're eventually inside. And the reason that I really love this technique is because the post-operative care is absolutely minimal from an owner's perspective and from the puppy's perspective. So the recovery is really rapid. Nearly all of the dogs that I would treat would go home the same afternoon. They would just need to recover enough from their anaesthetic and then they're ready to go. They don't need to have any exercise restriction and they can do absolutely all the normal puppy behaviours that we would expect. They can play with the other dogs, they can go back with their mum if they want to, they can be just reintroduced straight into the house. They don't have to wear any buster collar because there's no incision or surgical site that we need to look at, and they're pretty happy about that. And the worst thing they could do is just they might lick their vulva a little bit or their prepuce initially, but that's just going to be for a couple of days and they won't cause any harm. And we really see very, very few complications with this procedure. You would normally expect to see a little bit of blood in the urine for 7 days. And other than that, that should be it. So no nasty surprises. In contrast, open surgery we should only do from 16 weeks of age onwards, when the tissues have had even more chance to mature, because an open surgery is going to be a bigger deal. And it's a more expensive option than the laser. We also find that for the post-operative care, I couldn't find a golden retriever puppy with a buster collar on, so this is a little rescue dog called Moomin. So they would normally, after an open surgery, need to stay in the hospital 2 to 3 nights. We obviously do have a surgical incision then, so they normally have to have a buster collar on to prevent them licking. And it can be difficult in a multi-dog household to prevent the other dogs from licking. So might even need a medical pet t-shirt or something. We'd need to restrict exercise and play for 2 weeks. And so that obviously, to some extent, limits their socialization for a period where they're being treated. So when it's necessary, then we can do this. But if there's another option to do the laser treatment, then that is preferred. Medical treatment on its own isn't normally effective until we correct the anatomy. But some of you may have seen this, which is called propylene syrup, which is a very common treatment for incontinence in dogs. And what about doing no treatment? Well, we know that there are dogs that have ectopic ureters that are totally fine. So we might have some dogs that there's no problem. But in dogs that have incontinence or have urinary tract infections, if we do nothing, there's a potential that we might get very serious kidney issues. So I've outlined in green here, and this is a dye study where we've got one kidney which is a normal size, and then the side with the ectopic ureter, we've now got this gigantic kidney which is like a sack full of urine because of the back pressure that's built up here. So this does need to be treated, or it could cause a very severe problem. And we might have cases where we just get lots of urinary tract infections, and that's quite miserable for the dog. In terms of prognosis, then unfortunately, correcting this plumbing doesn't result in resolution of the problem in all cases. And that's probably the most frustrating thing about this condition. So in males, it's very effective, the treatment, because they've got this lovely long urethra. So if we correct their ectopic ureter, we would have a 95% plus success rate in having a nice continent normal dog afterwards. With the females, this urethra is much shorter, and it seems as though many of these dogs also have a weak muscle controlling this tube. And so in females, we find that it's only about 65 to 70% maybe successful in causing complete continence after we've corrected the anatomy. And in the remaining dogs, we think that this tube, the urethra, the muscle around it is too weak. And that still allows urine leakage, tending to be when the dogs are sleeping or lying down. So that's a big frustration. Ideally, we would hope that if we corrected the plumbing, then everything would be okay. Most are, however, significantly improved, even if they're not completely dry. And we may be able to completely solve the problem, as we'll see, with maybe some other options. So which dogs do well and which don't? Well, this is one subject of our research at the moment, because this is kind of the holy grail of treatment. If we could identify in advance which puppies were going to become dry and go on to have no further problems, and which were not, then obviously we'd know which puppies to treat and which to advise not to. But this is an area where we know what doesn't make a difference, but we haven't yet found the sort of the early sign, which is this dog is going to do well or it isn't. So different researchers have looked at lots of different things to see if it makes any difference to the outcome. And what they found are lots and lots of things that do not make any difference. So it doesn't make a difference if it's just one ectopic ureter and one normal, or both are ectopic. It doesn't matter if the ectopic ureter is just missing the bladder or if it's all the way out into the vagina or vestibule. It doesn't matter what type of treatment they have. So open surgery or laser have the same outcome. Doesn't matter if they've had infections before, and many other things. So we know what doesn't make a difference, but we haven't yet found what does. Now, part of the problem with previous research studies is that they have had many, many different breeds and many different ages of dog. And so that has brought in a variability, which means it's difficult to then sort the wood for the trees. So at Cambridge, what we've been looking at, thanks to the Golden Retriever Society, and seeing lots of one breed with this problem, we have been looking at just Golden Retrievers. And so far, we're up to about 30 cases that we've treated over the last couple of years. And we're hoping that because we are looking then at one breed, and almost all of them have been 12 to 14 weeks of age, that maybe with that group that's much more controlled, we will be able to find the answer to this question. Can we predict the puppies that will do well? So I think the jury's still out on that at the moment, but we're still collecting data, and I hope we'll have something further to report in due course. What about if we don't achieve a dry puppy after we've replumbed the anatomy? We would make sure that we've treated any urinary tract infection, and then usually we would add this propylene to the treatment, which tightens up that muscle of the urethra and hopefully stops the leaks. And we would then wait until a first season has passed, which unfortunately with the golden retrievers can be quite a long wait. If you've got a small breed dog, obviously you only have to wait until they're around 6 or 7 months. But with the Goldens, then we're usually looking at 12 to 14 months for a first season in order to find out if that's going to make any difference. And what we hope is that when they have that surge of estrogen, that's going to tighten up that muscle and make the difference between the last little bit of incontinence and being dry. After that, there are further options, but it all gets more technically difficult to achieve dryness if we haven't had a season and we've tried medical treatment and that still doesn't work. And then we're looking at more like surgical treatments, such as this implant in the bottom right. The next question I always get asked is, what about neutering? So what we know is that in medium to large breed dogs, that if we spay them, particularly talking about females here, that it can lead to a weaker urethra and it can lead to what we call spay incontinence. And so there are some risks with spaying a dog that's already prone to incontinence as to whether that lack of estrogen will cause the incontinence to return. And I think what we've discovered so far is that if we have a successful treatment of ectopic ureters, the anatomy is all corrected and the dog is completely dry, then it's likely that it's fine to spay that dog if needed, ideally after 1 to 2 seasons to allow the genital system to completely mature. If there's any incontinence remaining after treatment, then we feel that it's better to leave the dogs entire as long as possible. But obviously we would advocate neutering if there was any medical reason, like a pyometra, for example, which is an infection of the uterus. So can we prevent this condition? This is the question. So this is where a lot of our research has been headed. And a lot of what we've been doing is based on some previous work for this breed, which is quite a rare breed. So you may or may not have seen these around. These are the Entlebucher mountain dogs. These are a small Swiss mountain breed. And I think in the UK, there's only approximately 50 of these dogs registered. So very, very small niche breed. And these dogs have a huge problem with ectopic ureters. So based on that, and because they're very small in numbers, they have introduced an ultrasound screening test for both the dams and the sires. And that has to be performed before you can breed one of these dogs. That's on their list of required tests. There's also been quite a lot of work into the DNA of these dogs, searching for the elusive DNA test, which might be able to be the answer to our problems, and we could screen our dogs for this before breeding. The DNA tests are still ongoing, and that gene or genes are elusive at the moment because it's quite a complex inherited disease. But what they have been doing with the ultrasound screening is that they have been looking at the position of the ureters and their openings. So we ultrasound the dogs, and then the dogs are assigned a score of A, B, or C for each ureter. So an A is a score that they get if the distance from the ureter opening to the bladder neck is greater than or equal to 2 centimeters. if it's within the bladder but less than 2 centimeters, they would score a B. And if the ureter is ectopic, so opening into the urethra, they would score a C. And the overall score relates to the worst ureter. So if a dog had a right one that was an A and a left one that was a B, overall it would be a B. So we replicated this in the golden retrievers to see if this was the case in that breed as well. Are there dogs that have A, B, and C type and are otherwise clinically completely normal? So they don't have any history of any urinary problems. Here's just some ultrasound images. So this is a type A. This red jet here is one of the ureters. It's measuring 2.7 centimeters. That's lovely. The B one, we can lose a little bit the measurement, but that's kind of 1.2 centimeters. And then in our C type, we've got our parallel lines indicating we're in the urethra. We've got our 2 tiny little red jets. So we asked for volunteers to come down to Cambridge, and we had 50 dogs that agreed to come and take part. 16 of them were male and 34 of them were female. And we scored their ureters as A, B, or C. And we've got quite a lot of A's, as we can see, relatively fewer B's, and then only a few C's, but obviously these are the most important. So we found that about 10%, just over, of the male and female normal adult dogs had ectopic ureters. And obviously these owners didn't know that because the dogs were completely normal. So this was a really interesting finding and ties into what they found in the Entlebuchers. So in the Entlebucher scheme, then what they would do is they would screen all of the dogs, and then they would exclude any with C-type ureters, so those that have an ectopic ureter from breeding, and they would allow A's and B's to breed. They, unfortunately, their dogs are not great, and they don't have very many A's, if any, so they're really breeding with these B-type. Now, when you do this, this is an ultrasound screening test for the particular dog you're looking at. It doesn't tell you anything about the DNA of that dog. So you can have dogs that are normal, they've got A or B type ureters, and they're still carriers of the abnormal gene. And hopefully that's something you've come across before with other diseases. So the mother or the father don't have the problem, but somewhere in their DNA, they are carriers of the problem. So with the Entlebuchers, when they use this scheme and they exclude these C-type dogs from breeding, they will reduce their incidence of ectopic ureters in the breed, and they have done by about 40% over 5 years, but they will not get rid of it entirely because you will still have it hiding in the DNA of the normal dogs. Now, with the golden retrievers, it's such a big breed that it would be impossible to test all of the dogs before breeding, even if you wanted to, because the ultrasound is a very specialist thing to do. So instead, we could look at which dogs might be most useful to test. So in just thinking about this, if the dam or the sire has any history of themselves of having urinary tract issues, so that might be multiple infections or any other abnormal urinary signs, or they've previously either given birth to or sired affected puppies, then those dogs would be interesting to assess them to see if they themselves are affected. Of course, they might not be. Back to this abnormal band that we usually see in combination with ectopic ureters. anyone that's working with stud dogs and might be doing vaginal examinations as part of that work, this is just really to flag up that if you felt anything quite abnormal, or you felt this band of tissue dividing the vagina, then that would be a flag to me that maybe there's a problem. And certainly if there was any sort of anatomical difficulty with mating, then maybe this is the reason. There's something happening here in combination with the ectopic ureters that's preventing that dog from being able to be mated. It'll be useful to check. And then maybe we could look at the stud dogs, not those that are only siring a few litters, but we know that there are some dogs that are going to go on to sire many, many litters. And maybe those would be good dogs to check. Again, it's not going to be foolproof. They could be perfect themselves, but still carry that DNA somewhere in their genome. And ultimately, with the assessment of the dogs that we know are normal because they've had ultrasound screening and DNA that we're collecting from all of our clinical cases, we're still hoping that, again, another holy grail, one day we might find a DNA test for this condition, which would then allow all potential breeding dogs to be tested before having litters. So I